We still have to keep time reasonably well. So welcome back, all of you that made it through lunch without falling asleep. First of all, I'm Anders Signal from the Public Health Agency of Sweden. Sitting here together with Claudia. The rest of the speakers will be online, so we're going to have a bit of a challenge here. We're also supposed to have a panel in the end. We'll see if that's going to work, but at least there's going to be time for you to put some questions towards the end. And I hope you will be interested in doing that. I would also like to thank some big colleagues for putting together a fantastic meeting. It's been really a pleasure being here. So we're going to talk about climate change. It's interesting to note that almost all the previous sessions has also talked about climate change. So that's another challenge for us. But I think we are doing it in a slightly different manner in this session. So I hope you'll find some new things in it. Because it is really one of our major, I would say, things that might happen or will happen to us for sure. And I think it's interesting because it's one of these slow crises. I think COVID and many other things have shown that we are quite good as humans in many ways to handle a fast crisis. We can change our systems in many ways very quickly, but when it comes to tackling slow crises like climate change, AMR and other things, it becomes a lot more difficult because then there is always plenty of priorities that we need to do before we take care of these ones. So I think that's where the Public Health Institutes comes in very much, because if it's somebody in a system who really have the long-term view, it should be the public health agencies and not just run away and do the quick things. So I hope we can, in this session also, get some ideas on how we tackle both the acute effects, but not least the long-term effects of this kind of crisis. And the other thing that, at least from my horizon, I'm not the climate change specialist, but what I noticed is that in the climate change meetings, health is becoming more and more prominent. And I hope you share that view. And it's interesting that it's taken the climate change discussions so long to understand that this is also going to have an enormous impact on public health in many different ways. And it has already. So I think it's definitely very relevant that we touch on these subjects. So we're going to have a number of speakers online. We're going to start with a bit of an overview, connecting back to the COP discussions where health has become, as I said, becoming more and more in the focus. And then also give you some background on the working group of IANPHI that works specifically on climate change. And then we're going to end up with having some examples from a few countries on how they are tackling the climate change that we already now see. So first of all, I would like to hope that Guillermo Neto from Fiocruz Brazil is online and can give us some background on the discussions in the two recent COP meetings and the health aspects on those.
Bom dia a todos. Eu entendo que está havendo tradução, está correto?
So, Guillermo Neto, are you online?
Yes, I am.
Thanks a lot. You are welcome to give your presentation.
Thank you. Do we have translation for this meeting?
Yes, there is a translation, so you can do it in Portuguese if you want to.
Okay, thank you very much. It's a pleasure to be here with you all. And quero deixar aqui meu forte abraço para os colegas moçambicanos. Eu tive a oportunidade de estar aí fazendo uma assessoria pela Organização Mundial da Saúde na área de saúde ambiental do Ministério da Saúde, e foi um trabalho muito interessante, muito intenso, no ano de 2015, 10 anos atrás, e agora estou aí novamente podendo contribuir e colaborar, estando junto com vocês também. Então, saudações a todos. Nós fizemos uma apresentação que, obviamente, ela bastante curta, tendo em vista a limitação do nosso tempo, mas em que a gente traz um panorama das relações da saúde com a mudança do clima. E como é que nós estamos, então, no âmbito dessas últimas COPs, que, particularmente, nesse ano ocorre a 30ª COP em Belém, no Brasil. Nós estamos aí nos preparando. E eu já trago para vocês uma questão bastante importante e curiosa, que, embora a questão da emissão fóssil seja o grande vilão da mudança climática, no caso do Brasil, nós não observamos dessa forma. O Brasil é o sétimo país do volume de emissões, e se nós tivermos o recorte per capita, é o quarto do mundo. Então, tem uma contribuição muito importante. Vocês podem ver aqui nesse mapa que tem aqui na direita do painel, que nós temos tido um aumento absurdo das ondas de calor nos últimos 30 anos. Esse é o cenário da década de 90 e esse é o cenário até 2020, o último, que está mais em vermelho. E essa situação se agravou ainda mais nesses últimos 4, 5 anos. Entretanto, no Brasil, nós temos uma situação em que quase 50% das emissões de carbono são devidas ao desmatamento e 27% complementar a isso são devido a gases produzidos pelo setor pecuário e agroindustrial. Então, é uma situação muito interessante que nós temos no Brasil, em termos de particularidade, e temos tratado disso nas nossas políticas voltadas ao enfrentamento da questão climática. The next one, please. Esse aqui é um panorama desenvolvido pelo IPCC, que mostra como que, a dependendo das temperaturas que estão previstas, variando entre 1,7, 2,3 até 4,2, 5,4, o volume de dias e o acarretamento de problemas de saúde, especialmente de mortalidade, relacionados a isso. Então, obviamente, nós verificamos aqui, comparando o primeiro globo com o terceiro globo, um incremento muito grande na região, especialmente tropical, dos afetamentos de mortalidade devido ao aumento da temperatura ao nível global. Esse quadro aqui lateral, ele é um quadro sintético, em que ele traz um esquema, uma modelagem, em que traz as vulnerabilidades que estão relacionadas à mudança climática na perspectiva dos fatores de vulnerabilidade, aqui mais à esquerda, de elementos de questões demográficas, de questões geográficas, de fatores biológicos e de padrão de saúde, condições sociopolíticas e também fatores socioeconômicos. Então, esses elementos interferem, são importantes, e estão, obviamente, correlacionados com os padrões, né, as rotas de exposição, que são relacionados à mudança climática, os eventos extremos, né, o estresse de calor, a qualidade do ar, a qualidade da água e a quantidade e qualidade da água, a segurança alimentar, a distribuição vetorial, né, e ecológica de vetores transmissores de doenças, todos esses estão contribuindo para o que nós vamos ver aqui mais embaixo, que são os eventos de saúde mais fortemente relacionados à mudança climática. Tá? Obviamente que isso é mediado pela capacidade do sistema de saúde estar preparado para o enfrentamento dessas questões. Isso é uma das coisas que foi muito fortemente debatido na COP, tanto 28 quanto 29, na perspectiva de tornar os sistemas de saúde resilientes a essas condições. Aqui embaixo nós temos os resultados, né, os afetamentos na saúde, uma variedade imensa de condições. Acredito que vocês estejam debatendo isso, que vão desde problemas infecciosos, transmissíveis, como também injúrias causadas por eventos extremos e os problemas crônicos, né, relacionados a questões cardiovasculares, pulmonares, que têm uma relação muito grande com as implicações de longo prazo das alterações promovidas pela mudança climática, especialmente o incremento das ondas de calor e o movimento do ciclo das águas, né? Esses são dois grandes elementos que nós temos observado, pelo menos aqui fortemente no Brasil. Para seguir adiante, next, please. Aqui nós temos um sumário, uma linha do tempo de como se dá a relação da saúde com a agenda da mudança climática. Desde a criação, quando nós tivemos a grande conferência de Estocolmo, em 72, uma série de orientações, deliberações foram adotadas, e uma delas foi de reunir o conhecimento, a competência acerca do que ali se viu anunciado da questão relacionada à mudança climática, o aquecimento da Terra. Então, em 85, nós temos a criação do IPCC, que é um instrumento das Nações Unidas, é uma estrutura, um painel intergovernamental muito poderoso, muito forte, que reúne aí milhares de pesquisadores ao nível global, que vem sistematicamente estudando, desde a origem, todo as causas e consequências e recomendações relacionadas à mudança do clima. E aqui embaixo nós temos toda a sequência do caminho adotado pela a Convenção de Mudança do Clima, a reunião do Rio de Janeiro, em 92, o estabelecimento do protocolo de Quioto, né, de conhecimento de vocês, a reunião de Copenhague, da COP15, e um momento também importante, de 2007, quando o IPCC e o Al Gore, como vice-presidente dos Estados Unidos, recebe o prêmio Nobel pelas evidências que trazem os relatórios do IPCC acerca do afetamento sem questionamento relacionado à mudança do clima. O Encontro de Paris, né, que tem um papel fundamental ainda até hoje, onde foi feito um grande acordo acerca de definir no máximo 1,5 graus enquanto limite para poder ter o controle da situação da mudança do clima, e as sequências de encontros até nós chegarmos a Baku, antes aqui Dubai, né? Depois Baku e agora a COP de Belém. Tá? Do ponto de vista da saúde, o que tem de importante? A Organização Mundial da Saúde, em torno de 90, faz o primeiro assessamento, a primeira avaliação do impacto na saúde relacionado às mudanças climáticas. Depois, nós temos, em torno de 2005, um estudo muito interessante sobre a carga de doenças relacionadas à mudança do clima, onde você prevê que mais de 150 mil mortes por ano são relacionadas à mudança climática naquela época. O terceiro, a conferência da WHO, né, da Organização Mundial da Saúde, acerca da relação entre mudança climática e saúde, a quarta conferência em Glasgow, né, que foi a primeira vez que a saúde passa a ter um pavilhão é, na COP da mudança do clima, novamente aqui no 27, em Dubai há um salto de qualidade, e que nós temos um momento, um dia exclusivo para a saúde, reunindo centenas de ministros de Estado dos membros, né, das Nações Unidas, coordenada pelo diretor-geral da OMS, e que nós tivemos um debate muito importante e uma declaração muito contundente acerca das relações inquestionáveis entre a mudança climática e a saúde. O debate em Baku ele se deu muito centrado em dois aspectos fundamentais: a capacidade do sistema de saúde se tornarem resilientes ao enfrentamento da mudança climática, e isso implica, como nós estamos vivenciando aqui no Brasil, uma mudança muito grande de cultura da relação da saúde com a grande determinação ambiental que a saúde nos traz. Isso, inclusive, suscitou um debate muito importante no país acerca de uma releitura acerca da questão da Covid-19, uma vez que, de fato, a grande implicação da Covid-19 foi o afetamento causado pelos humanos, pela sociedade humana, nos ecossistemas, né? Os ecossistemas silvestres. Então, esse centro de preocupação ele passa a ter uma atenção muito grande e, nesse momento, dentro do Plano Nacional de Mudança do Clima do Brasil, nós temos diversos planos setoriais e o plano de saúde ele está muito voltado para esse elemento da, dar competência e capacidade ao sistema de saúde de poder estar atuando em torno da questão, especialmente da adaptação à mudança climática. O outro ponto relevante do debate na COP29 é a produção de conhecimento, né? Nós temos ainda muito pouca produção ao nível nacional e subnacional dos países acerca das relações entre saúde e ambiente. Então, essa é uma agenda inconclusa que está posta. Certamente, os institutos de saúde pública a nível global têm um papel fundamental não só de produzir conhecimento, como também fomentar e dar suporte aos ministérios da saúde a fazer com que a gente tenha essa possibilidade sendo alcançada. Obviamente que isso implica em mobilização de recursos, de fundos, para poder sustentar a produção de pesquisas, de investigações, etc. Para a COP30, nós estamos numa fase ainda preliminar, fizemos um encontro organizado pelo Ministério da Saúde do Brasil, com representação de diversos países, e, obviamente, articulado com a Organização Mundial da Saúde, a Organização Pan-Americana de Saúde, que é a regional da OMS aqui nas Américas, e elaboramos uma nota conceitual, a qual vai ser submetida a debate num outro encontro que vai haver, já de maior porte, de caráter mais ampliado, nos dias 29 a 31 de julho de 2025, agora, e as recomendações desse encontro vão ser, então, objeto do debate que vai ser feito no Espaço da Saúde na COP30. Então, esse é a rota, é o caminho, e é importante que os países todos estejam aí sintonizados com as documentações que serão disponibilizadas pela Organização Mundial da Saúde, para que nós possamos estar contribuindo e participando desse importante debate. Esse é o cenário aqui desse quadro. The next one, please. E aqui, para concluir, nós temos a rota, né, o caminho traçado pela Fiocruz para poder colaborar com isso. Não sei se todos têm conhecimento, mas a Fiocruz é o correspondente ao Instituto Nacional de saúde no Brasil, vinculado ao Ministério da Saúde, e nós temos uma competência de ciência, tecnologia e inovação para poder dar suporte ao sistema de saúde. Então, foi definido, agora em 2024, a constituição de uma estratégia Fiocruz para clima e saúde, que tem diversos componentes em seu plano de trabalho, que envolve tanto reunir a competência técnico-científica do país relacionadas à mudança do clima, como também induzir, principalmente, iniciativas que possam estar exatamente fortalecendo o sistema de saúde e também dando competência no plano do conhecimento científico e nas estratégias de enfrentamento da saúde, por parte da saúde nos territórios, na realidade do país. Tá? Então, temos, por exemplo, um seminário que vai ocorrer agora da Fiocruz, nos dias 15 a 18 de julho, prévio a esse encontro que eu acabei de informar a vocês, que nós vamos reunir a competência técnico-científica da Fiocruz com tomadores de decisão e também com a sociedade para fazer uma discussão voltada sobre as relações da saúde com a questão climática, a perda da biodiversidade e a poluição. Além disso, estamos instituindo, no âmbito da Fiocruz e do Ministério da Saúde, um centro de síntese que seja capaz de produzir o conhecimento adequado a tempo para auxiliar no processo de tomada de decisão e, obviamente, de fortalecimento das ações de saúde. E vários outros aspectos que estão sendo considerados, inclusive de mobilização junto à sociedade. Nós temos muitas tecnologias sociais em desenvolvimento no país que têm uma relação muito grande no sentido positivo da relação entre clima e saúde. E isso é um elemento que nós estamos querendo trazer à evidência e fazer exposições e apresentações para o público que irá participar da COP30, tanto antes da COP como depois também, para que nós possamos fazer com que essas tecnologias possam ser disseminadas e apropriadas da maneira mais razoavelmente possível. Por exemplo, no caso da Amazônia, em que a grande forma de mobilidade é através dos rios, não? A Amazônia é entrecruzada por um volume monstruoso de águas que percorrem os rios até chegar nos oceanos todos, e a modelagem das unidades de saúde na Amazônia são unidades móveis para atender a população ribeirinha dos rios. Então, são unidades básicas de saúde que são formatadas, preparadas para fazer com que a população em torno dos rios possa ser atendida. Comunidades originárias, como os indígenas, e comunidades também tradicionais. Atualmente, nós temos 100 unidades dessa na Amazônia e, de acordo com o plano do governo Lula, nós temos a previsão de alcançar, até o fim da gestão, até o final de 2026, 300 unidades. Então, isso é um alcance muito importante, chega a alcançar milhões de pessoas e é um exemplo concreto de uma tecnologia que possa ser utilizada, claro, que com toda a preocupação da agenda de carbono zero e os elementos que estão relacionados com isso. Bom, esse é o cenário que eu queria trazer para vocês. Agradeço muito a oportunidade e sigo aqui no painel à disposição.
Thank you very much.
É uma fala final do presidente da Fiocruz. Fica à disposição de vocês, colocando a centralidade da agenda da relação da saúde com a questão climática. Desculpe. Obrigado. Thank you.
Thank you very much for reminding us of the long history we have of different meetings in the area of climate change and how health has come into that, and also the impressive work you're doing in the agency in Brazil in this area. So we're going to do it like this. If you have any more technical questions, you can raise them now. Otherwise, we'll save the more bigger questions for the panel towards the end of the session. Anybody who wants to give any comments or have any questions directly now? If not, then let's move on to the Climate Change Thematic Committee of IANPHI, who has been doing your work for a number of years. And Sebastian Denis, you will give us a presentation and show us what the committee has done so far. Please go ahead.
Yes, thank you very much. I hope you can hear me.
Yes.
Okay, thanks for the invitation to speak today. I really regret that I could not join you for this meeting, but I'm very happy to do it remotely from France and hope that everything is well in Maputo today and so far. So I will give, as you said, an overview of the work of the IANPHI Climate Change and Health Thematic Committee. As some of you might know, we have this committee since 2022, and the overall objective of this committee is really to engage and support INPHs as key climate actors. So previous slide, please. No, the plan is for just the second slide, please. You're going too fast for me. And so back in 2022, we've created this thematic committee that gathers today all these green countries you can see in this planisphere. So as you can see, we have a lot of Nordic or North country from the north, a few from the south, but we would like, of course, to increase the number of participants. So we have almost, I think, around 30 countries and 90 participants. So we would be really keen, and we would really welcome any volunteers from countries that are not represented. And I see Guilherme that Brazil is not represented in the committee, to join the committee to extend the work we've been carried out since 2022. Next slide, please. So as I said, our ambition is really to advocate for engaging and supporting national public health institutes as key climate actors, and to push for having the health argument in the center of the debate on climate change, because most of the debate is today driven by environmental or economic or geopolitical considerations, whereas we really think that, and we are really convinced that health could very strong argument to push the action and of course the intersectoral action to tackle the effects on climate change, and in particular the effects of climate change on health. Next slide, please. So to do so, may I have the next slide, please? So to do so, we first delivered an initial roadmap of the thematic committee, so which is on the cover page, is on the left-hand side of the slide, entitled "Engaging and Supporting National Public Health Institutes as Key Climate Actors." So this roadmap was released just before the creation of the committee and presented during COP26 in Glasgow under the umbrella of WHO Health Pavilion. And we were really happy, in fact, because this roadmap was also mentioned in the G7 health ministers statement in 2022. So immediately we had a great visibility inside the G7 regarding this roadmap, which is of course really important for us, because we are really here to support policy and to accelerate the actions to tackle the effect of climate change. Next slide, please. So in this roadmap, we described what could be the priorities for national public health institutes in terms of climate change and health, and that priorities became the priorities of the committee. So we've got 5 of them. First, as I already mentioned, advocate for strengthening the capacity of NPHs to contribute effectively to climate and biodiversity research policies and action. So you see that we go beyond climate change because we are also convinced, and it's also from scientific-based evidence that climate change, biodiversity, and global pollution are interconnected and have a cocktail effect on the health. So it's very important to focus on this topic. The second priority is to enhance capacity, competence, and training through peer-to-peer support and knowledge sharing between NPHs. So what we are doing currently through the committee, this committee being a network of NPHs in which we are doing these different tasks. Then increasing collaboration with international and regional organizations active in the fields of public health and climate change. And so in this perspective, what is really important at the national and international levels is that NPHs or IANPHI set up some collaborations with other institutions that are dealing with environmental or meteorological issues, and then we'll see later that we set up some relation and memorandum of understanding with different international organizations on this field. The fourth priority was to support the greening of public health services, and the last but not the least, to monitor progress in the NPH's involvement in climate change policies through key indicators. So I will now illustrate different concrete example of what we've been doing since 2022 on these different topics. Next slide, please. So these actions are, of course, really aligned with the essential public health functions of the National Public Health Institute. So this graph refers to the roadmap in which we describe which kind of essential public health function could be related to the climate change activities of NPHs. And of course, you see that these activities are perfectly aligned with different core functions of NPHs. First, around protection, prevention, and education. And I would like to mention that we are not here just focused on individual determinants, but of course, the health argument is also very strong to try to push the action on environmental sector or urban sectors, for instance, speaking in terms of city and how the municipalities can adapt to the issues of climate change and heat waves, for instance. Second core function is the monitoring and evaluation. So monitoring and evaluation to assess the effect of the different climate change factors on health. And of course, one of the most important one and already, which has some already visible effects are the heat waves. And the last one is the response and facilitation of the action in case, for instance, of extreme weather events. And of course, these three functions gathered all together to act to push and to facilitate the setting up of healthy environments to protect the health of populations, taking into account the fact that the most vulnerable people or the most vulnerable population are the more at risk regarding these threats related to climate change. Next slide. So in terms of intervention and action around extreme weather events, we released in 2024 this report entitled Climate Change and Public Health, the Essential Role of National Public Health Institutes in Transformative Adaptation to Extreme Weather Events. So this was a very large collaborative work inside the committee. As you see on the left-hand side of the slide, we have different and numerous countries for different regions of the world that participated to this report by giving us some examples of concrete action on all the panel of the different core functions I have talked sooner, and we'll have in this session concrete examples from 2 countries just after my presentation, so I will not last too long on this issue. But that's a first example, concrete illustration of what we produced in terms of framing a role of INPHs in such event. Next slide, please. Then we also decided to focus on key indicators, so related to the 5th priority I've mentioned sooner, key indicators, and one of the most important indicator for us to act immediately is the EAT health metrics. Next slide. Because we perfectly know from the scientific evidence, next slide, please, that EAT is a very priority in terms of public health. We will have, due to climate change, an intensification of the heat and heat waves worldwide. So it is said by IPCC in 2022. That means an increase in the frequency, intensity, geographical spread of hot days and heat waves. And these heat waves have impacts on ecosystems and human societies, as we can already see each summer nowadays. So these effects are really observable nowadays, and it will not come in many years. These heat waves have different numerous consequences and multiple health effects. So you see here a kind of panel of different effects: hyperthermia, respiratory effect, cognitive impairment, accidents, pregnancy, and of course mortality. Next slide, please. And so we decided to launch a survey across INPHs around the world to know how this thematic of health was really integrated into the program of INPHs. And so we sent this survey to 120 IANPHI members. In last year, we received 49 complete and 10 incomplete responses. And the results were a little bit striking, because we've seen through the survey, so which was not really representative because all the INPHs did not answer, but we've seen that among the respondents, only 18 INPHs are monitoring effectively heat impacts, 18 are currently developing a program, and 19 are not working on heat. So you see that we still have a few number of INPHs that are working at heat, whereas this is a concrete and immediate risk for health. We've seen as well that 7 INPHs answered that they did not identify it as a priority. So this really underlines the need to advocate for that INPH take into account this major health risks in their program and in relation to the Ministry of Health and other ministries, because of course this is a really intersectoral thematic. And then what we've seen as well across the INPHs that answered to this survey is that there was a great diversity of methods, indicators, reporting among the INPHs monitoring the health impacts, and so for sure a need to somewhere standardize if we want that we have to have a coordinated action and coordinated reporting, try to standardize this heat health metrics. So next slide, please. And so we decided to really work on 2025 on 2 upcoming milestones on this topic of heat health metrics. The first one that will be a technical workshop in London, so physical technical workshop that will take place in London, UK, in end of June, and which is organized by one of our very important partner, WMO, but also with Wellcome Trust, Lancet Countdown, really also that gathers a community of academics really engaged on this issue, Santé Publique France and RKI. And so the topic will be to share their experience on technical heat health metrics consideration. So we'll have experts and biostatisticians, for instance, that will discuss during 2 days on these issues. And this technical workshop will help us to prepare a more strategic workshop which will be which will meet in November 2025, back to the One Health Sustainable Forum. And so on this workshop, IANPHI will be the leader of the organization, and our ambition today and so far is to adopt a kind of frame for NPHs for Eat Health metric. So relying on the work we will have done in June. And so this workshop will take place in Lyon, and that will be the first time that we will have the opportunity to gather physically the committee in a unique place. And so this workshop will be funded by the French Bank for Development, AFD, and the European Environment Agency, EEA. So this is two very important milestones in 2024 for these Eat Health metrics issues. Next slide, please. And so doing that, we are also very convinced that we should engage also key partners. And so since 2022, we have been working on different memorandum of understandings with the European Climate and Health Observatory that is funded by the European Commission and led by the European Environment Agency. WHO and WMO and the GEAN, the Global Eat Health Information Network, that allows to exchange experience across the world on health issues and eat health issues. And of course, the Lancet Countdown that I've already mentioned gathers a lot of expertise from academia on the eat health metrics and climate change indicators. Next slide, please. So we're also doing a lot of webinars and try to disseminate all what we produce. So we've been organizing a very important webinar during the French presidency of the European Commission, as a lever for action on climate change. We've also organized this webinar on indicators, and we had a very high number of people that were connected to this webinar, and a little teasing on an upcoming webinar during the second semester 2025 on extreme weather events, the report I've mentioned sooner during this talk. Next slide. And of course, I would like to thank you for your attention, and of course to all the committee members that are doing a lot of work, which is often some voluntary work, to try to have the same view on this very complex topic and try to frame some standardization and advocacy. So thank you very much. And of course, the IANPHI Secretariat, and particularly to Ines Ferrer, that should be with you, and who provide a lot of support to the committee. Thanks a lot.
Thank you very much. I hope you also can stay on for the rest of the session, so we can have some questions towards the end. But until then, before we move on, any questions to the committee? Everybody's saving their questions for last. Let's hope so. Okay, so we're moving on to some practical examples from a couple of countries, starting with Claudia here next to me, who's going to talk about heat waves and flooding in, or heat waves in Austria. Thank you.
I hope it works. Yeah. Thank you very much, Anders. Please, can I have my slide? Yeah. So I'm honest with you, when we were asked to talk about heat and heat waves in Austria, I felt a bit awkward, coming from a country with an average temperature of 9.3 degrees, the long year average, talking in Africa about heat waves, but my team convinced me. We have to add that the average temperature in my country rose by 1.9 degrees only in the last 10 years. And the last year was the highest average temperature ever recorded in our 150 years of temperature recording, with 3% in average higher, not only in the also in the mountains. We have a lot of glaciers and there, so this is also causing problems on the other end, like the mentioned flooding sometimes. So saying that, we understand, and Sebastian explained that well, we are mentioned on these case groups, and this is what I will talk a bit, that really of all the climate change really materializes in my country in these heat waves. You know, we have more deaths in heat waves in times of temperatures above 30 degrees. This is what we define as a heat day in my country. And analysis shows that especially in the population of 65 years and plus, the death toll on these days is 3 times higher than in comparable days without these heat days. So this, together with a strong political commitment, the Minister of Health in the last period of the government was from the Green Party. And also there was a big ministry with a lot of resources on climate and agriculture and an environment, also headed by a Green Party member. So there was really a strong political commitment in my country to address this issue. And so one key milestone also for us as Public Health Institute was that, next slide please, a competence center for climate and health was being built up. For some of us, it was like looking back, because I think in the year 1995, until that time, we were also being in charge of health and environment in our country. But then a new environmental agency was founded. So one person was still working at our institution who used to be part of this team. But so what's the focus now? This competence center has 2 departments. They're working interdisciplinary together from science, policy, health. We have health experts there. We have climate experts there. And they have 2 focus. The one is on climate neutrality and sustainable transformation. This is, for example, we have a program we call it the greening of our health services. So basically hospitals get support, also money and advice to reduce their carbon footprint and other things. How to use less medical gases, for instance, is one very popular point there. But now I will talk more about what the Department for Climate Resilience and One Health will do. And this is one big field is based on the recommendations of WHO. A climate resilient health system consists of 10 building blocks, and one key block here is related to early warning systems and heat action plans. And I will now dive a bit deeper into this topic of the heat health action plan. Next slide. First, we take a look at our Austrian heat action plan. Actually, it's a really short history. The first one was released only in 2017. It was a very short and concise document. But as we said, the summers got even warmer and hotter, and resulting also in higher public pressure, which made it necessary to update this heat action plan and also prepare like a guiding document for the regional and local health actions. You have to know that in Austria, we have a quite, let's say, region-oriented healthcare system. So the regions have an important role, the federal provinces, we also call them, in of everything being done on health in our country. We based the document on the WHO document on heat and health in the European region, which is really an essential guideline, at least we think, and gave us best practices how to tackle this problem. A crucial part, which is also in WHO, and we did it, was the involvement of we set up a working group more or less with representatives from the federal state, from these mentioned provinces, from the Austrian Weather Health Service, from the ministry involved. So we really tried to go for health for all policy. Also, an advisory board was set up with experts in the field, and organizations then were asked to revise the document and give also their input, so that we could really have a consensus document. This is also, I have to say, a very Austrian approach. We always aim for a consensus. This is part of our, let's say, political nature or governance. So finally, this plan was presented in June 2024. You can see pictures here. And please we have to acknowledge that this plan is the one on the national level. So giving guidance, as I said, for the provinces and the communalities we have, but they have to work on their own actual operation. To make it operational, they have to define the correct steps to be taken. But lucky for us, also this was seen as I said, there was quite some public pressure on newspaper releases of, people being found dead in their homes without air conditioning. We have to know that with this average 9.3%, the only things who have routinely, I would say, air conditioning is cars in my country. So many houses and also nursery homes, hospitals, they don't have any air conditioning. Okay, so we can, next slide, please. So I want to guide you through the action plan. There's two colors. Why? Because the first part, the upper tiles, are the original plan from 2017 with the national heat warning system that was being set up and some information and communication tools like the folders that started. But now we have it revised based on the WHO recommendations. And so we have added 3 chapters and an appendix and annex. It's heat protection for the vulnerable population groups, because further analysis to the ones I told you about, the elderly population group, it was also vulnerable groups. So those who live in small apartments, have no way, are not very mobile, cannot go to a park outside, because this was common behavior. If it's really hot, people tend to flock in parks. So that's why we had to look into them. Then we did also special measures for those people in health and social care setting, as I mentioned, nursing homes, because in our country, it's still very common that elderly people who can't take care of themselves are in some, settings. They're not, many of them are still taken care at home, but many are also in nursery homes. So, and then we improved the communication and the health and the heat health related information, and we made more innovative warning systems. So also looking the future. Oh, this is the one I mentioned. These are a couple of the examples we showed you. We have, for instance, which is broadly used from our Austrian weather service, the Geosphere Austria. We have a heat warning and forecasting system, because this is important for the plans we made, that to have some advanced warning, some foresight in that the heat wave will hit us, so they can set the necessary measures. At that time, when the heat wave is approaching, we set up, a heat phone, so that people can get information, where to find a cool place, or, oh my goodness, no fire this time, I hope. Because I was sitting in the first row yesterday and saw the fire and the flames, so I'm pretty impressed. Okay. We're talking about heat, that's why. So it's this heat warning system should give timely alerts for this impending heat wave. So the mentioned authorities and bodies have due time to implement the plan that we made. This is the responsibility not by the Ministry of Health or us, but the Austrian Weather Service. And there's also like a protocol that goes into place, resulting in broadcasting in television or in the radio, because we are discussing also social media. But to be honest, the target group, which is the more elderly and less privileged, they're also very likely not to have a smartphone with an alert, because we basically have such Austrian-wide disaster warning program, which is sending text messages on the mobile phones. But perhaps this will come in future. But now it's more broadcast in the regular channels. Also, this heat phone is also, it's hosted by our National Agency for Nutrition and Food Safety and Health Safety, but it's more or less paid for by the Ministry of Health. Next slide, please. And as I said, as a regional level, there's additional measures. And here an example coming slowly to an end, is how we plan to address the vulnerable groups and in the social care settings. So these are toolboxes you see here. We have it in several languages, and we cooperated. How did we came up with the tools? Less in the end, we had exchange with other countries, also through the IANPHI committee, and we let's say cooperated with heat body initiatives and to look at brochures they had in other countries like the Czech Republic or Slovakia, Romania, and more or less made our own of it. And the next slide, please. What are such selected measures, as I told you? It's an adaptation of the infrastructure, and this is also something the plan foresees short, immediate steps if we have another heat wave pending in the summer. But of course, in the long run, we are rebuilding the cities, for instance. So having more shade, having places with water sprinklers, even planting more trees. So there's some money in the country where you can apply as a community that you have, let's say, your big open space, you get some greening of this place. So we have money for that. And then, of course, what's also necessary, this is what we learned, we do some training for the staff working in the mentioned healthcare services or social care services, that they really look even better if people are drinking, that water is there, and so on, and they get some extra training and there's specific information material. Yeah. And it's also in some regions, water is then provided automatically to the persons, so they don't need. So it's brought actively to them, for instance. Yeah, and of course we need to ensure the refrigeration of food and things like that. It was sometimes not necessary, so they stored the regular, pasteurized milk somewhere, but now we need cooling for all of that. Finally. Next slide, please. We do a monitoring of this impact. This is very interesting also for the scientists in our institution, but also in other Austrian universities. So more women are affected than men, but it has to do with the age group because we have more women in the higher age groups than men, I think, like in most countries. Unfortunately, it's not easy to compare. I was asking my team, let's do a comparison map in Europe, but it's not so easy because what's a heat-related death in a country seems not to be very standardized. I can imagine, I think 30 degrees is already a very, very hot day. You know what I mean? So why is not the heat day definition 28 degrees, for instance? So I personally asked that my team, but this seems not to be homogeneous. I think in Italy, if people are doing things in Sicilia with 42 degrees, I would never think about it, So, of course, this has to do with adaptation. Yeah, you see we had 486 heat deaths 2023. 2024, it's more, but it's not the final data yet. That's why you see with this toolbox, we can monitor everything related to heat now very thoroughly. And now, really the last slide. Thank you. I just give you, what's my lessons perhaps for you I would like to share. We had a very, very strong commitment by the Ministry of Health and also reaching out to the other ministers because it was a health in all policies approach necessary, of course. We involved really all the stakeholders from the various sectors working on health. Finally, we were lucky that we had the good WHO recommendations, so we could use them, not to define everything on our own and wasting time. And we had the exchange like here in IANPHI, and we collected best practices from other countries. So what really reached patients in Bulgaria or in the Czech Republic. So we went a bit to our neighbors. And Germany, of course, we also consulted. And finally, we have started to have exchange with the actors. So that's not necessary for them to tell through the newspaper something to the minister, but they can have a direct interaction and can voice their concerns or their plan forward. That's it. Thank you.
Thank you very much. coming from another cold country, I can really vouch for that the effects of heat is not just the temperature, it's also the change in temperature, I think, very much. So
Yeah.
I think we're struggling
In
with
such a
it.
short time, that's the problem in our country.
And when you're not really used to protecting yourself from the sun, rather the obvious. So it's I think sometimes even bigger changes than in the hot climates. Please, Neil.
Thank you. Yeah, really interesting presentation. You mentioned some of the challenges around definitions of what is heat. I'm interested in the extent to which countries are using the Sendai framework for disaster risk reduction and many of the indicators that have been developed for a whole range of different hazards at a national level. Because a huge amount of work goes into trying to standardize definitions. But then the question is, are those definitions used routinely, and which agencies use them? And it goes back to the monitoring and evaluation question that we asked before, the importance of standardizing definitions, but also of generating indicators that people are going to use on a regular basis.
So,
maybe you want to answer, otherwise
you could.
I thought that maybe that's a question for Sebastian.
Yeah, I thought, was it directed to me or to, I was also thinking on Sebastian.
It was you and Sebastian, yeah.
Sebastian, can you comment on this right now?
Yeah, thank you very much for this remark and very important question. And indeed, it appeared during this survey I've presented and during the discussion inside the committee that even the definition of heat or heat waves were not really standardized. And so that's why we decided as well to organize these two events in 2025 to try to somehow standardize something, but also recognizing that standardizing for everyone would be maybe complicated because we are faced we are faced to different risks due to climate change according to our geographical position in the world. So, but that's really the topic and the ambition of these two events, and we hope that we will manage to write kind of frame for this topic, so very focused on heat by the end of the year.
I can add, if I may, for us, it was good that we managed to have a joint definition for Austria alone, because there's a lot of, NGOs and public awareness, people, a lot of people are working in this field. As I said, there was a lot of public pressure, and the definitions and the data are so diverse. So it's really hard if you start to look into figures for Austria, for my country, to identify what's the real situation and what's perhaps, forecast assumptions, whatever.
Thank you. Any more questions, please? Can we have a microphone over there?
Thank you. It's a very quick question. You mentioned that there are 400 something deaths during 2023. Can you elaborate more on the age distribution of those cases and if they had any comorbidities, existing comorbidities? Because it's really astonishing. This number is very, very high.
Exactly. It's unfortunately very high. That's why we had to do something. No, it's, I mentioned briefly in the beginning that it's a, how can I say, it's in the population group above 65 years. It's 3 times higher than an average person in this age group has a likelihood to die in the same period of time. And we also see data, but it's not totally conclusive because we have 2 little years in the end, when there's a really heat wave, meaning there's more than 3 consecutive days of 30 degrees. This is then we see peaks, this is what we know for sure. And we also see when we look at the place of death, it is also in the institutionalized settings, meaning in these nursery homes. And so obviously we needed to take more care that people have enough to drink, go to a cooler apartment and so on. And by definition, so people in the nursery homes I think the average age is around 87 years or so. So it's really, we talk of the high age is really a risk factor, if you want to say so.
Thank you. Please. This is the last question, and then we need to go to the final discussion.
Okay. Good afternoon, all. I'm Dr. Joy Shatilwe from Namibia. I'm just interested in the topic. And my question is, do you experience maybe some possible disease outbreak due to extreme weather? It's just my simple question.
Yeah. I'm honestly not prepared for this question, so
I'm sorry.
I rely, but we go into bilateral contact afterwards, and I will forward you to my head of the competence center, and I'm sure she can answer you well. I'm sorry, I don't know really. I don't think so, but I don't want to.
I think the general experience in Northern Europe is no, we don't really see it from the heat waves. The heat has, of course, changed many of the vectors in Northern Europe and might do something there in the long run. What we have seen is that we see a bit more of Vibrio infections due to swimming in the Baltic Sea. That can be very, very well related to the change in temperatures, but not for these short heat waves for a few days. The main is really death from heat exposure.
Yeah. And of course, we have pickle bugs who now survive our winters, which didn't survive previously. We were brought to Austria, some sort of. Yeah.
But let's give some time to our.
In the report, I have mentioned on the role of NPHs in extreme weather event. You have a couple of examples on infectious disease outbreaks. For instance, Zambia and cholera or Mozambique that has a seasonal risk mapping and disease forecasting. So maybe you can find there some accurate examples for your question.
Thank you. And let's move on to Bangladesh and Professor Tahima Shireen to talk about flooding. I hope you're online.
Yeah.
Okay. Please go ahead.
Am I audible?
Yes.
Okay. Thank you. So, good afternoon. I apologize for joining virtually. However, I am very much pleased that I got the opportunity. So I'm working in Institute of Epidemiology, Disease Control and Research. This is actually a public health institute in the country. Now I am going to present the country experience on managing the risk of climate change and extreme weather. Next slide, please. This is my presentation outline. Next slide, please. Actually, like Austria, Bangladesh is the temperature is also increasing in Bangladesh, and if we compare with the previous years, this more in the recent year. For instance, I mean the temperature variation was 0.0067 per degree centigrade per year during the previous decade, like from 1961 to 1990. However, the temperature is now rising sharply, that is 0.03 degrees centigrade per year from 1991 to 2019. And the rainfall is also increasing at 8.4 millimeter per year with regional specific spatial variation. And for these climate change, the rainfall variability. The rainfall is varies from year to year, and there is more frequency of river flood, flash flood, rainfall, flood, storm surge flood, tidal flood, and urban flood, and the sea level also rised. And here you can see a map in between the text, map of our country, and 11 areas in the country are identified as a climate stressed area. So this is very alarming. And we have 64 districts. Out of these 64 districts, already 30 districts districts are now flood prone. Next slide, please. If we look at the history, in 1974, the flood was due to heavy monsoon and river overflow, and there was impact on the economy, and there was a scarcity of food, and over 30 million people become affected for this flood. And during 1988, flood had catastrophic consequences occurred in August and September. The water inundated around 60% of the total land in the country. Next slide, please. 1998 flood is one of the biggest flood in recent history. 30 million people were affected with 1,050 death tolls, and those death was due to drowning, snake bite, and flood-related other illnesses. And in 2004, flood was similar to 1998 and 1999 floods, and during that time, 2/3 of the land was submerged under water, and flood caused many deaths and many people become homeless. And entire flood lasted for around 65 days. Next slide, please. In July 2018, the highways were submerged due to river overflow. Almost every part of the country was inundated. You can see the area where the flood occurred on the map. And Bangladesh also experienced flood in 2020, that is during COVID-19 pandemic, and at that time it was very difficult to keep the people protected from SARS-CoV-2 infection along with other flood-related diseases because of overcrowded situation in the shelter, and the hospitals were preoccupied with the COVID-19 patients. In 2022, May to June, 2 flash flood affected different parts of the country in a massive scale. Next slide, please. And most importantly, in August 2024, there was catastrophic flood affected 11 districts in northeastern and southeastern part of the country. And for the first time, these districts experienced flood, and 73 sub-districts were affected in those areas. And this flood was due to the combination of heavy rains and surge of water released from dam in Tripura, India. Next slide, please. Here we can see how the flood affected Bangladesh in last 70 years. Almost in every year, Bangladesh experienced flood. However, there were 10 major floods since 1954 to 2024, which caused 3 to 5% of GDP loss, and in each flood, and 19 times 25% or more areas were affected. And if you carefully look at the graph, in the recent years, the frequency of flood is more. Next slide, please. Always flood comes with health issues and health system risk. Many people died of drowning, snake bite, and also suffer from acute watery diarrhea due to contaminated water. Affected people also suffer from skin disease for the contaminated water, and they live in a very overcrowded situation in the shelters, and they also suffer from eye infection, ear infection, and there is also effect on reproductive health and mental health. Most importantly, there is disruption of supply chain management, and thus it creates difficulties to reach the affected people with safe water, with foods and essential drugs. Next slide, please. Actually, Bangladesh managed flood situation through our regulatory framework. We have Disaster Management Act, Disaster Management Policy, National Disaster Management Plan, and Standing Order on Disaster. These disaster management policy, plan, and standing order on disaster guide us how to integrate different stakeholders and how to reduce disaster related risk at different tiers, like at the national level and also at the subnational level. And with this support, an inclusive program is implemented to combat the flood situation in the country. Next slide, please. Actually, it is a very busy slide on how to manage the disaster in Bangladesh. I'll try to simplify it. We have National Disaster Management Council, which is headed by the head of the state, and down that there is Ministry of Disaster Management and Relief. And under the ministry, there is National Disaster Response Coordination Group. This group actually is responsible for inter-ministerial coordination for disaster-related risk mitigation at different tiers of the country, at the national level and also at the subnational level. If the extent of flood is more, then the risk mitigation activities and initiatives are executed at the national level. Otherwise, it is managed locally. Next slide, please. We have also civil military coordination for disaster management, disaster related risk reduction, especially during evacuation of the affected people, distribution of the relief to and to reach out the people who lives in hard to reach areas. So in these cases, we actually get support from the military, and we have a very good civil military coordination, especially during the during any disaster, any flood or other disaster when happening in the country. Next slide, please. Actually, for flood management, the country has some initiative like flood management strategy, national plan for disaster management, national water policy, national water management plan, the flood forecasting and warning center, Bangladesh Water Development Board, standing order on disaster with the manual and guideline, and the hospital disaster committee. And we have also other relevant stakeholders like Bangladesh's Red Crescent Society, IFRC, NGOs, and different UN agencies and development partners. And besides that, we have also non-structural flood management initiative like embankment, improvement of the drainage system, and community-based approach. Next slide, please. Actually, for disaster management, Bangladesh is a role model. We have effective early warning, dissemination, and evacuation mechanism in place. We have around 5 million trained and dedicated volunteers and dedicated shelter for the flood affected people. And we have a whole of society approach for mitigate the flood related risk. Next slide, please. Again, we have challenges. You know, Bangladesh is a population density is very high. I mean, it's 180 million people in the country within a very small area, around 150 square meter area. So it's very difficult to manage these densely populated area during any disaster. And so we have some challenges like reaching to hard to reach area during the flood situation, limitation and inaccessibility of upper riparian countries' hydrological and meteorological data, insufficient institutional capability, and technical constraint on flash flood forecasting, dissemination of flood messages to the people in right time, in a right way, and we have also budgetary constraint to when we fight against the flood or other natural calamities. Next slide, please. So that's all from my side. Thanks for patience hearing.
Thank you very much. Extremely interesting. I know we are keeping you all from coffee to keep you awake, but I think we have time for a few questions. You see Neil?
Yes, thank you for the presentation from Bangladesh. I wonder whether there are any lessons that can be learned from Bangladesh from the people who live on the chores areas. When I was in Bangladesh, I visited, and there were some people who'd moved for 23 or 4 times. I mean, literally every year their land was flooded and they moved back onto arable land. And I suppose one of the things about adapting to climate change is how we utilize the land and how we modify our lifestyles to fit. So are there lessons that can be learned as well as dealing with the consequences of floods? Are we learning lessons and adapting the way that we live? Because people are increasingly moving on to floodplains, and are we developing strategies to alter our approach to living in these vulnerable areas?
Thanks. You want to comment on that from Bangladesh?
Okay, yeah, actually, you actually mentioned rightly. We have a different, char area in Bangladesh, and also there are some areas which is very hard to reach. So, and basically, the people who lives in the char area, they have to move. I mean, every alternate years for the flood, because their land is distorted with the flood water, and then they had to move to other places, and they had to build their houses, and they have to start their life there. So, but they cannot stay for a long time to their land, and sometimes people become homeless, and those people who have very small amount of land, they usually lose their land as a consequence of the flood. So thus poverty comes in.
Thank you. I think we had another question over there. Please.
Voilà, donc bonjour, je m'appelle Fodé Amara Traoré, je viens de la Guinée. Je voudrais la remercier pour cette présentation. Et au niveau du Bangladesh, c'est vrai, souvent il y a des inondations. Donc ma question, c'est de savoir, est-ce qu'ils ont eu au même moment des inondations associées à une autre catastrophe naturelle? C'est une question que je pose. Et la gestion des catastrophes est-elle logée au niveau du ministère de la Santé ou un autre département? Si c'est dans un autre département, quelle est la part du ministère de la Santé dans la lutte dans la gestion des catastrophes? Merci beaucoup.
I'm not sure.
Est-ce que
Did you get the translation in Bangladesh? Or?
Yeah, but I couldn't get it completely because I started later.
Yeah, no. I
Repeat.
think the question was mainly about which part of the government is in the lead in the disaster management.
Okay, actually we have a Ministry of Disaster Management and Relief who actually down there are different structures who actually deal with the whole situation. However, they are also connected with the other relevant ministries, like they are connected with the health ministries, because following any natural calamities, the health issues come in. So the other ministries like the health ministry, environment ministry, the military force, and law and enforcement agencies, and other development partners and NGOs, they also come in during the disaster management, and there is a very good coordination. They coordinate each other and manage the whole thing.
Thank you. I think we had one more question. Please.
Oh, good. Thank you. Sonja Mera from the Norwegian Institute of Public Health. And thank you so much for the panel. It was very interesting and really underscoring the complexity of this issue. I had two questions going back to the presentation by Fiacruz. I think that one takeaway was his slide on this long history we've had, and also seeing how we've changed, the climate change issue has really moved into the health field. And I think this is a very important perspective, because of course, when you see this, it's a very visual effect when you can see suffering or the impact on people and people's health, then you can potentially more apt to have reaction. But my question is that it's a bit humbling to see that his slide goes all the way back to 1985. And if he had comments on, do we see momentum? It's been 40 years. We've had climate and health on the agenda. And then my second question and comment is to Sebastian, in that I think the panel has really captured so many interesting country experiences, but some work that I had done with some coastal communities, what was very interesting was that beyond these direct impacts of on health, there's these indirect impacts. In this case, for coastal communities, the impact on farming and fishing is very much impacting individuals, both food security, income, and we also know that many sectors are impacted by heat, reducing the productivity in terms of manufacturing, agriculture. This has been documented. And so my question is, if the committee has, are there country experiences that are actually going in those directions beyond going into the indirect and secondary effects of climate? Because as we can see, it's such a complex and a challenging issue. Thank you so much.
Thank you. I think unfortunately we lost our member from Brazil, but maybe the committee can say something about at least the second part of your question.
Yes, thank you very much. I don't know if it will answer directly to your question, but indeed we have a subgroup on One Health approaches, so that we make sure that we take also into account the fact that climate change, and as I said, climate change is very interconnected to loss of biodiversity and chemical pollutions, and so of course have a lot of indirect effects, as you mentioned. And so we plan to write a paper, so we've got a draft so far on this topic. So I'm not sure it would directly answer to concrete actions regarding these complex issues, but still that we will have a common frame inside the committee on this topic. And maybe we could identify as well different concrete action that we could have in the next years. But as I mentioned, the work is really done on the basis of voluntary involvement. So we need also to be very cautious on the fact that we do not overwhelm participants with some works, but still that there's some place, of course, to tackle these less direct issues, I would say. So a very, very accurate question. Thank you very much.
Thank you. I think we need to close this session. I think we once again dealt with something we quite often deal with in this group, something that needs a whole of society approach, where I think the MPIs very often is very well situated to handle that, and a complex approach that needs the coordination of many different sectors of society. And also a problem that has clear socioeconomic and health equity parallels that we also need to take into account. So thanks a lot to the presenters, and thanks to the audience for great questions, and I'll let you get away with coffee. Thank you.